Hi, I'm Ruth O'Regan from the University of Wisconsin. I'm a breast cancer medical oncologist. So in patients with hormone receptor positive breast cancer that's metastatic, we usually recommend endocrine therapy initially for their treatment along with a CDK inhibitor. We very rarely recommend chemotherapy for patients because the endocrine therapy CDK inhibitor combination is so effective. However, if you have a patient in what's called a visceral crisis, which means they've got a lot of disease, for example, in their liver, or they've got a lot of disease in their lungs, then you might use chemotherapy because it does work more quickly in some instances than using endocrine therapy. But I would say overall, we very rarely use chemotherapy first line in these patients. As patients are treated with endocrine therapy and different sequences of endocrine therapy, their cancers eventually become resistant. And at some point down the line, we then would recommend chemotherapy for these patients, mainly because we've run out of other more targeted therapeutic options. For patients with early stage hormone receptor positive breast cancer, we really are using less and less chemotherapy for these patients in the adjuvant setting. The reason for that is that we have genomic assays that we can perform on the tumor that basically tell us whether these patients are going to benefit from chemotherapy or not. And it's estimated that we're probably saving at least 50% of patients from chemotherapy by using these genomic predictors. So this is very important for patients because obviously there's a lot of toxicity with chemotherapy, and we'd rather not use it in patients who are unlikely to benefit.